Barbara talked a little bit about personal space. Be aware of how you approach your client. If I'm dealing with somebody I think might be pissed off, angry, drunk, or whatever, or just doesn't like the way I look, I don't do, hi, how you doing? You don't invade their space. You always set it up so that your client that you're going to get ready to talk to has an escape route. Also for you. The first thing in self-defense is run. That's the one that always works for you. So if I'm going to approach a client, it's from the side. How you doing? I'm going to show them my hands. Because this is threatening. What have I got? I'm paranoid. Even this.
Besides that, you can move your hands faster. When you're up here, when my hands are here, like I'm talking like this, I can always block anything. But if I'm down like this, seconds count.
Although it sounds silly, your hand position can alter your energy. It'll alter your energy in the people near you. You can try this at home with your loved ones. Stand like this for a while in front of your loved one. And then ask them how their energy feels. And put your palms down. This raises your energy, this strikes. You're dealing with somebody with hallucinatory process, and you can hallucinate with every sense. Visual, tactile, taste, smell, and visual. So having visual, any little thing is going to distract them. So you may have to use hand movements to kind of bring them back to focus to you. Don't do this, because when you do this, your hand doesn't stop in their eyes. It keeps on going. Nice tail things. When you approach your client, only one person talks.
Yes.
We get really nervous, especially if the person's being active. Our adrenaline's going. But you gotta shut up and let one person talk. If the first person you talk gets the, hey asshole, I don't like you, try somebody else. Don't be offended. Because I'd rather talk to Barbara than Gene anytime.
Yeah, so cool.
Because I could probably talk to her and let me rub her back, and I can't do that. If my client and I have been unable to communicate and make a bridge, and I think they're a danger to themselves or others, then I'm going to do a physical restraint. Always do it in twos. You always have to know your partner a little bit. You need to know each other well enough that you know if a person has stronger left or right hand, what your preference is. If you're doing a 4-person takedown, who's a headhunter and who likes the legs, because you don't want to collide. You do this with the least amount of force needed to control the situation. You never hurt your client. You never use martial arts. You never do moves that are going to hurt them unless you have to escape something like being bit. Then for that brief second you do whatever you need to do to get out of there. So if I'm going to walk up to her, I'm basically going to walk up like I'm going to shake her hand, but I'm going to grab her wrist. Your partner's going to do the same thing.
Hey.
You're going to reach up underneath her arm,
Oops, almost tripped.
and I'm going to put my body behind hers. I'm going to put a little pressure into her hip. Now I can hold her wrist, I can hold my shirt, I can hold my own hand. If I leave her palm forward, go ahead and flex your elbow. That's a lot of strength. If I put the palm back,
Go ahead, there you go.
I know.
You got it.
Won't break my own elbow.
this takes hardly any strength at all to hold them because you don't have the muscles and tendons to move in that direction.
You guys, I want you to also observe her height, his height, and my height. Height is actually not going to interfere with me taking her down, or her weight, or his weight. We all can do it no matter what our size.
But it
Or
will
weight is.
hamper her if we're ambulating her. Because I can get up here and lift. Now she's on her toes. I've got my hip behind her hip, my knee behind her knee.
And then we can bring her down.
And if I try to walk her, she has very little strength to fight me. You want to walk her first?
Yeah.
So,
So what happened is we got her standing up. She's just really coherent with us. She's just, I'm going to tell her, listen, we're going to a safe place. Are you okay with that? And she's going to say yes. So versus me being intimidating and threatening, For her safety, I'm gonna hold on to her wrist and her arm, her lower arm right, or her upper arm right here. This is not to intimidate her or threaten her or make her feel that she's being controlled. So we're just here to do it as a safety issue. Then she starts to get a little lightheaded or starts to get a little wobbly. So what we're gonna do is we're gonna actually wrap our arms around. We're gonna cross over in the back, as you see. So if she's like really, it's just kind of, she needs help and control, then that's okay, don't drop on me yet. Then we notice that she's actually getting ready to go down. What we're gonna do is we're gonna take one step back. Ready? And this way, you don't want to take her down forward because she'll end up with both legs twisted underneath her like this and back like this. So you want to go back with her, bring her down. It's not going to be a big deal. She needs to go down. She needs to go down. That's her body saying she needs to go down. So it's okay. And then once we assess the situation, we decide whether she's going to be able to be ambulated or if we need to get a stretcher or a gurney. Then all of a sudden she pops up and she's turned into this schizophrenic, flipping bitch.
Out of control.
Come on.
So, go ahead. So we're going to actually bring her ass down because now she's becoming a threat to both Joel and myself. So Gene, go ahead. She got a wiggle ass.
We've got her leg blocked.
Okay.
So now she can't go forward. Now, it's not muscling her down. It's using body mechanics. In fact, if I take a step forward, she's got to go with it. And then you slowly lower it down. Third person's excellent to have if possible because of controlling the shoulders.
You guys, one red flag here. This area from here to here is a hot zone. Do not put any weight on it. The weight goes here, 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 hips and knees and ankles. Don't lay on the chest.
Never long bow. You never push off on your client. You never put pressure on long bows. That hurts like hell. Unless you really want to be there all night and they start mellowing out and you go, ooh, they'll jack up a little bit and you'll be there longer.
Thank you.
Basically, you're using your weight. You're not fighting them. Lift your leg, please. Thank you. So I'm going to lay up on her shoulder. You all right?
Yeah, she's cool.
Okay?
Yeah, she's sitting her head adjusted.
Now, if you're really lazy like me, you got a roll of paper towels to put it here. Embarrassing thing, Gene and I both fell asleep on the client one time.
So did the
They're
patient
still
after a while.
tripping, so they're still going, and we're back there.
You notice my body is in the armpit. You will end up with BO, which is, it's okay.
Well, we should. My
And it's not
eyes are
yours.
very, very small.
So right now, as you see my position, none of us are really bearing our weight on this patient or this person at all. It's all about the joints, mobilizing the joints. So at the count of 3, she is going to use all the power she can, thinking that I'm the weaker on this side, to get up. I got a cramp in my thigh, so
Need some massage?
So Gene is going to come over and take over because I got this cramp and I really got to go to the bathroom.
When you're changing out, he comes in from behind, he does not put his weight on her. As he comes in, she rolls out. Yeah, let's get you going.
Sorry.
Yeah, you can go.
So I'm going to head out to the
Your risk area is
bathroom.
here. If the client is trying to bite, you have to make sure you try to stay far enough away. It's another good reason for paper towel rolls. Going in between your client and yourself, they bite paper towel, they don't bite you.
Sometimes you have slippery butts, slippery non-dressed clothing people. This is where actually it would be good for somebody not putting their full weight on them, but resting. You're still sitting on your feet because you've got that get up and go power. You still need to get up and run.
But their feet point in the same direction. Not
And you
straight
ride
out.
them.
Their feet go one side or the other. They don't go like that.
We've had over 400-pound patients that are bare naked that we've had to hold down. They'll do a couple of twirls, but it's still, we have control of them, believe it or not. And Bob can
Here she's
verify
doing-
that one.
She's doing the ride. This is a ride position. You are going to come up, hands on the butt, check the wallet.
Back down.
But again, with your clients in this stage, you still have to, you're agreeing in the medical, you still have to get that first set of vitals.
Respiration.
So you got two other people running around here trying to do all this stuff.
So
It gets crowded.
if you notice that person's mental status kind of decrease at a point where they're not talking like they were before, you know, we can always assume that somebody's on a mind-altering chemical, but not, you know, we don't know for sure. So we got to watch that level of consciousness to see if maybe there was a head injury prior to. So red flags, just don't assume everybody is on drugs. It's more about visuals and the psychological as far as being able to determine the change in condition.
And you might have head injury, you might have diabetic situations, person might have just been assaulted. There's all sorts of things that might have.
Speak up, Kathy.
Mention K-hole.
K-holes. K-holes are actually a short-lived little thingy. This is what I've done for K-holes, even though I don't think it has any real value to it, but you got somebody they're gonna go and they're gonna go down. They're just gonna go. And they're like, and you have the friends who say, well, they did some K. What I found, even though it doesn't really have any medical background on it, is I go, well, listen, I've got some water and I've got some sugar in it, and I'll make them drink it. Within 5 to 10, 15 minutes, they're like completely gone. The K-hole is real quick-lived, but it's getting through the K-hole. There are levels where it can get a little more intense, where people can go into respiratory arrest. That's another red flag. But usually it's just that moment. They get there, they go there, and then they'll come to and they'll go, you know, what the fuck. And undoubtedly, and with K-holes too, we also have ketamine, that which is K, and GHB. So those are still things that are happening at the EDM shows. Like I said, the K-hole is just letting the people around know that it's going to be okay. It's short-lived. It'll come out. But keep an eye. Watch vitals.
Neuroleptic malignant syndrome. That's where your body can't thermoregulate. If you're laying on your client and all of a sudden you start to feel like they're cooking, you may need to do a rectal temp, which is we're not going to demonstrate that. But
Don't worry.
some of these drugs and your body stopping thermoregulation, you can get a surface temp of 97s and 107 inside. We lost a client at Cal Palace years ago because we brought him in, thought he was drunk, he had all the symptomology, oral temp was 97 something, and at the end of the night when Skip Gay was sewing somebody up and we couldn't wake this guy up, I mean, we were getting smoked from the sternum rubs. We were starting to start a fire on his chest. And he said, did anybody do a core temp? And when we did a core temp, he was over 106. So we all kind of went home and felt really stupid because we missed a step. But it was just the beginning of when people were using the drugs that would actually cause that. So I see it more in psychiatric medications than fun medications.
It's a big side effect of Molly, though. We had a patient here at this venue last month, a couple months ago, that had an axillary temp of 105, 106. So we just rolled her, and she apparently was rather ill. Kathy?
She was in the critical care unit for about 4 days. When she left us, she had a heart rate of 140, but by the time they got her to the hospital, it was 200. When she was intubated, she did actually well. She was a lady in her 30s. And what we did for her was we packed ice around her, called for this, to roll her fast, and started an IV and gave her Ativan.
Where'd my victim go?
Hey.
She's hiding.
You know, I forgot to mention this morning, we don't use Haldol very much.
Yeah,
anymore.
we're using less and less of it for a while, just a little more. But a lot of times the benzos is all you need to
Well,
take the edge off.
The other reason is Haldol's one of those drugs that can cause neuroleptic malignant syndrome.
Tardive dyskinesia can come from one dose and it never goes away. That's the person on the bus who's going like this. And you turn around and you slap him because you think he's being
Yeah.
obscene, you know?
But it's primarily, when they're coming in with so very altered and we're ending up rolling them. I'm afraid he's Haldol in that situation.
Except the
A, it's not
Ativan takes-
needed because they're not hallucinating, they're not psychotic, they're not.
But in most
Disturbed.
cases, the Ativan would take care of the
Yeah, it's
extrapyramidal
the Ativan.
symptoms, but Hound dog, it ain't a fun drug. It only sells for $5 a pill in prison. It's not a fun drug. You know what the most expensive drug in prison is? Tobacco.
Tobacco.
$750 for a jar of it. Anyways, self-defense stuff.
She's
First step of self-defense.
You don't need to run.
Grab his beard.
No, relax. If you get choked, this is not good for a nurse. Have any of you been to New York? Nobody's been to New York. Did you have to get a cab? How'd you get a cab? Then you look for it.
Yep.
If you do it the wrong way, just keep going.
I need a miracle.
That's right, I need a miracle there. Another method is to put your hands together. Place your fingers together and come straight up. You need to be careful with this, because if you hit their nose, you can damage their nose very seriously. And if she's on top of me, I don't want to do this, because we're going to get much closer. If we were laying down and she was doing this, I'd put one arm under, one arm over, and rotate. Natural body mechanics is this hip comes up, so if we're really close, which we're not going to demonstrate, this will force you to roll that way when I extend. Then I can go the other way. So that works from front and back.
That's the important thing, to run afterwards.
Right, you
Get
go
the
about
hell out of
6 of the
town.
security people and come back. Here we go. As soon as you feel my hands here, I want you to take your arms straight down and lock your elbows. Okay?
Okay.
You relax?
Mhm.
You sure you're relaxed? You sure? Okay.
Okay.
Now, if I was going to do a full Nelson, this could hurt you seriously. I could hurt your neck for the rest of your life. She just put her arms straight down, lock her elbows, and I'm going to try to get my hands in. And I've done this a lot of years, so I know how to cheat. Now, if I'm big, and my name's Bubba, I just pick her up and carry her around like a toy. Sorry, I spent too much time in prison. Okay. If someone doesn't, do you know how to full Nelson?
Yeah.
Yeah, go ahead. This is when you go, oh shit. If somebody gets you in a full Nelson and they know what they're doing, they can really damage your neck or they can break your neck. So your response should be to make a C collar for yourself, and I can't do this really, so I'm just going to do this. Now when she moves me, I'm not moving at my neck, I'm moving at my waist. If she puts pressure, I'm moving at my waist, not my neck. I still look funny, I look like one of those little birds with the mortar thing. You guys are too young, you don't remember that. Okay.
Oh, I know that.
Okay, my turn. Now I better let you do this.
Okay.
One arm choke. Now, you had training? Now, the important thing right now I want to worry about is breathing. Because she's torquing on this, I can't breathe. So I'm going to turn my head, drop my chin into her elbow. Now she can still torque, but I can breathe. That's the important thing. Now I got to go, how do I get out of this? Well, let's see. Elbow up, wrist down, slide. Push off, run. Okay. You have a safety zone. In most psych settings, that's supposed to get this right. Step, kick, okay. Step and a kick. So if I'm just trying to make contact, this is about the distance I'm going to be from my client. And I'm not going to go, how you doing? What's going on? Because this is a big target. I don't want to get kicked here. I'm old. They don't grow back like that anymore. So, side. If she kicks me in the side of my leg, up here on my ribs, you have a little bit better protection. And if she charges me, this also puts me in the I'm out of here position.
Yeah.
Instead of, because I don't want to fall to the ground and get pummeled. One hand. The only reason a person can hold on to you is because they have a thumb. So if you get grabbed, the weak point's the thumb. All you need to do is rotate toward the thumb. You can hold on. You won't hurt me that much. Ow! Ouch! You got a good grip? You sure? You sure? Old psych nurses always wear long sleeves, because if I do this and she gets the shirt, you're gonna see this little naked upper torso running down that way. I'm giving this up. Okay, 2 hands. Now, she's got a thumb on both sides, so I can't rotate. Because we rotate, we might as well be skipping down the street. So I'm gonna reach through, grab my own hand, and then propelling my body backwards, and bring my elbow up. Again, you have to be careful, because if you stepped in with that, you're gonna take her under the chin, and you wanna do that. So. Here. I won't, and then come back, I don't wanna lose it, so. You can have a ponytail, long hair, and they start pulling it. Grab between them and your head and pull into yourself. Now you're very vulnerable, because if she's really angry at me, because I took her parking spot, she's going to start hitting me. And roundhouses can get a lot of force. So basically, I'm just going to keep rotating in. I'm going to get very close. And I'm just going to wrap her up. I want to get hit from this far away. It'll still hurt, but not as much. I'll do this slowly. This is the only move I teach that hurts the person. Oh no, there's one other. But if they grab you this way, this way, this way, basically again, you don't want to lose your hair. Put both hands on top of theirs, put your elbows together, and rotate toward the outer aspect of this. How's that feel?
That's okay so far.
You see how that's going to go?
Yeah.
She's gonna
I
do
can
the
tap if it
rest.
hurts.
No, if I do this full motion and you don't tap, you'll hear the snap.
Yeah, but don't do that.
You got a nice loose grip?
Yeah.
And the cool thing is, you'll hear a little pop, and you're gone. You come back and go, I'm a nurse, I can take care of that. Come with me, RockMed can help you. If you get bit,
Oh, yeah.
my turn. If you get bit, don't pull away.
No.
Don't donate a chunk of flesh. The human bite is probably one of the 3 nastiest bites in the world. Unless you go get bit by one of those monitor lizards and Galapagos Islands. Nasty bite. You don't want to give up that chunk of flesh. Push in. Push in with all your might. You're trying to shove all the way through there, whatever they're trying to take their teeth out. Just shove in. If my buddy's getting bit, I don't walk up and go, I gotcha!
Yeah.
You come and help anchor it. If you want to elicit the person to release, there's a bunch of things that they teach you in the state and with corrections and all that. None of them work really good. There's a pressure point just below the nose, but if I'm a real good biter, when you do that, I go, now I've got you and them. So what I tell people to do is take your glove, put it on. Take 2 fingers, put them up the person's nostril. Have any of you ever done a sinus swab? I go about that deep into the sinus. Looks scary. Q-tip down. That's basically what you want to try to put your fingers that far back. And then if they still don't release, you pretend it's a potato chip bag, grab the chin and go. It will let go. Over 35 years in mental health, all acute psych, I've never had to do more than put my fingers up their nose. And they go, and then you go, and you take your buddy and sooner or later in psych, you will get something like a bite or spit on or urinated on. Or the dreaded, he pooped his pants, somebody's got to go clean him up. Wasn't that you, Bob?
I've done a few of them.
Here's why the cow pals, oh, there's more fucking Bob, he'll take care of him. Kaiser.
Yeah, very good.
What'd I forget?
How about to get them off of something that you want to release them, like they're holding onto a wheelchair and you can't get them to get
Again, it's the
released?
thumb.
Wait, it's their grip. Once again, it's the grip. Can't do much with anything more than just taking that and pulling it out, and they will let go.
So the main things to really worry about though is once you start restraining somebody and they start getting really squirrely and they're too much for you and you have to put them in some form of mechanical restraint. And in RockMed there's probably going to be Velcros or quick ties or soft ties. I don't even think we got the leathers anymore.
I have them.
Kathy does.
Other uses of restraint gear, okay. And we don't, I carry handcuffs because I worked corrections, but legally for short transfer, I'm a registered nurse. I can place somebody in mechanical restraint for up to an hour. Then I have to go whine at the doctor and make sure it's okay. If you're not an RN, or you don't have the doctor's blessing, you can't place your client in mechanical restraint. Now, putting them on a gurney, you have to secure them so they don't fall out, and that may involve like a wrist cuff. Try to avoid the chest cuff. Waist belt's fine. Across the ankles.
And know the knowledge of the restraints, how to apply them, how to do a quick tie. If you don't, ask.
At the shows, we
Don't
can teach you.
assume that you know how to put them on because you're watching somebody else. That could be the safety of not only you, your partner, but the patient. So make sure you know what you're doing and how to do it before you do it.
During
Yeah,
downtime,
but
during the
I-
shows, we always go through and review all those straps if you want.
When I got bit, it was because the straps got a little loose and the guy who had a deck must have been about that long went out there and bit me with it.
We all get dumb, we all get complacent, so I made the mistake in my career of stepping in between the patient and the staff that were fighting, thinking I could stop them. They both hit. Safety first. This is a true story, Cal Expo, one of the officers and I were chasing somebody we thought was under the influence. We chased him all the way up to the point that he hit that cyclone fence. When he went through it, we stopped and waited. We let the local authorities deal with it. Don't place yourself in a position where you're going to get hurt if you can help it. You are valuable to a bunch of people. Working in space or site, just the fact that they connect with you may be enough. The old timers aren't going to get offended when the client goes. Don't be worried to step outside the box. I got in trouble at Napa State Hospital while running to an alarm when the patient looked up at me and went, Jesus! Well, my beard was long. And I laid my hand on her head and said, yes, my child, you're cured. They discharged her 3 days later.
All right.
The mind is powerful. I work in a prison setting where the guys drug seek. When I was doing afternoons mental health crisis for the entire institution, 6,000 inmates, guys would call me and go, I'm gonna kill myself. I'm so upset. I'm gonna have to cut myself. Well, can I give you a drug? Is it a good drug? Yeah, it'd be a good drug. Look at me, I'm gonna give you a good drug. I go get a Tylenol and crush it. In prison, if it's crushed, it's a narcotic. I come back shaking, take this. But promise me you'll lay down after you have it. Well, why? Because when you fall down and bust your face open because I gave you this med, I'm going to be embarrassed and I'm going to have to deal with it. I come back in 15 minutes and the client should be asleep. Your suggestion is powerful. Your verbalizations are powerful. Your tone is powerful. Realize that it's okay, it's going to be all right. Will work for some. With other ones, it might be something as basic as, stop that. It may be as simple as Barbara going, you're really cute, but you're a little out there. Whoa, man, I'll straighten up right now. But realize you're doing space in every part of RockMed. Because you may be dealing with somebody who's lost their credit card. They could be as psychotic as somebody that's been crazy all their life.
Mm-hmm.
It's fun to talk to people and mess with their minds. Anything else?
Nope. I think
Sure.
that kinda-
Bob, did I miss anything?
No, well, the one I like is what not to do. Not bend the wrist for pressure points. Not, you see the cops doing that all the time. You got to remember, they're on drugs. When you think you're putting a pressure point to get him down, he don't feel it because he's messed up, and it just pisses him off.
And there's time. Realize being naked is not an issue.
Yeah.
Of course, Bill Graham thought it was when we had the naked guy in the elevator here, and he had the reporter with him, and the doors open, and here's RockMed with a naked patient. He's talking about how wonderful his concerts are, and we're hitting the close button. But you'd be amazed at the people you meet, too. people like Las Vegas, we had the guy who was a dealer, and he came down, it's like, what time is it? I gotta go to work. And we're going, thank God he's back.
Double down. Double down.
And where do you work? We're coming to guilt trip you later. That's right.
We had a tripper in Vegas, remember the one that just kept yelling, double down. Double down.
I remember the good-looking woman who was half naked with the bodybuilding boyfriend who came in with her and sat next to her, and she looked at, is it you and I? And she went, I want to do both of you. I said, did you do what she did? No, good. Or the client we had that his girlfriend was sitting with him, and he started talking about his male friends and how much he wished he could be with them. Kind of ruined their relationship. But psych's fun, and you do it every day. You do it in all forms of medicine, even a table service. You're doing stuff.
I'd like to remind everybody that doing the medical aspect, that we are not cops, we're not confiscating, we're not taking things from people, we may put it aside. If it's a large quantity of something, we will be turning it over to the proper authorities if that need be. But it's kind of one of those, you ask a patient what their name, what they're on. It's like, you don't get that information right there, right now. It's not, don't intimidate them because that's what they feel like. They feel like they're being cross-examined. They've never seen you before. You've got those get up and goes on. So just remember, it's kind, gentle, loving, caring, non-aggressive, non-intimidating form of approach. And like I said, before they leave, we're going to get that information, or they may have that on their person. Also, remember, we're going to be looking too for medical alerts. That's one thing that we will be searching possibly for, is to make sure that that person doesn't have a medical alert in their wallet, around their neck, on their wrist, in their belly button. They have it everywhere nowadays. So it's just, like I said, once again, it's non-intimidating, not a police attitude, not that aggressiveness. And Kathy was going to add something?
Yep, there's only one time we will confiscate drugs from a patient, and that's if we're sending them to the hospital. Then we will make sure they're not holding when they go to the hospital.
5 doses of LSD will get you 10 years in the federal pen.
Yep.
Just because you had one momentary lack of
Judgment.
Las Vegas police asked us to come down and check on this girl. We got there and she had pot, mescaline, and some other unknown substance on her. And we went in and did the assessment, and on the way out we said, hey, did she have anything with her? Well, she had this. Picked up the pot and and the lieutenant said, what are you laughing about? This so little of this. Throw that away. What's this other stuff? Oh man, this is probably bogus, man. I don't think this is real. If he had booked her on all those substances, she'd be doing over 20 years in a federal pen.
Yep.
But because he knew rock med and he gave us a little bit of leeway, the fact that we just threw it in the trash didn't matter to him. And he didn't have to do all the paperwork. He was happy to give her to us. So,
And then chemical restraint?
chemical restraint is the Ativan, Haldol.
Or adamant.
Sometimes we used to use Valium. Sometimes you can use something as simple as a Benadryl or a minor tranquilizer. Benadryl, Bistril, Dramamine, melatonin, but sometimes you have to be careful because some people who do speed, you give them a minor tranquilizer like Bistril or Benadryl and it jacks them. Sometimes you have to be a little careful with what you give them. Haldol you will fight. So if the guy feels it coming on, they will try to fight it. It's not a good feeling drug. I know. I got jabbed with a needle once. They were going to give a person a Haldol shot with, and they didn't inject into my hand. I had him let go, and I pulled out, cut the needle out. I went home. I slept for 18 hours, and I did not move. Not only in sleep, 18 hours. Boom. Not a good drug.
Had a young woman, we came to her and we were talking to her, she was tripping wildly, and then somebody said something about using Haldol, and she said, Haldol? And we thought, no, this is not right, we're not going to give her any Haldol.
And John, what's the last thing you want to say?
Oh yeah, remember this above all. It is always, 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 always okay to dance.
And we do dance with patients sometimes.
Yes.
Yeah, we've danced, sure.
Any questions, thoughts, answers, suggestions,
Conclusions?
recipes?
What about contacting people's families and their...
Minors, you contact families, because a lot of times you'd rather them go home with mom and dad than go home with their friends. If we have somebody and we can't figure out who they are, we're going through their cell phone, we're going through their wallet, we're trying to find a contact. Because we like our patients, but at the end of the show, we can't open the beer till they're gone.
And we don't give patients rides home.
Yeah, that's way too much liability. We're not an ambulance service. Yes,
What do you do if they're tripping and they have a weapon?
we take the weapon. Now, if they're tripping and they're banishing the weapon, I'm getting the boys with the badge to go deal with it. And after they get the weapon, then I'm gonna go take my patient. Yeah. No, we're not security, we're not God, we're not going out there and trying to take weapons away from people. But you know, you may be out there dealing with somebody who's kicking the hell out of somebody's car, and you know he's gonna be assaulted. So your first approach is gonna be, I got you, we're going down. But you don't do it alone. You always have partners. There's always time to watch and call backup. You get on the radio, they send out 4 or 5 more people from Rock Meadow. Maybe they'll send a security person or 2. If you're working with security, you have to educate them, because they're used to doing the pain compliance, and we don't play that. And tell them to stay with you. I got hit. I think it was here. No, Henry J. Kaiser. I got hit Henry J. Kaiser because I walked up to help the security guy bring the tripper in. He went, oh, good, Rock Med. I'm holding on to my client. He's going, boom. Stop that. And his dad, who was an old deadhead, was looking at me going, no questions, no thoughts, no answers, no recipes? You want jailhouse hot chocolate recipe? 3 Musketeers bar, chop it up, put it in hot water, stir it up, let it sit for a minute. You know, 3 different layers of chocolate. Thank you. There's money.
Mine?
Okay.
Hey.
That,